Before we begin tonight's questions, let's hear from the governor.
Well, thank you. Thank you to the stations for hosting this. Thank you to all of you who are tuning in. This is an unprecedented time, and yet we have seen some of the greatest people doing their part to help one another. I'm thinking about the nurses and the doctors and the fire and the police, the teachers who are helping students in this incredibly challenging time, the sanitation workers and the child care workers. Thank you for doing your part too. Whether you're just staying home or you've donated blood or you've been able to donate to your food co-op and to help people get meals that they need right now. Right now, we are in the midst of a global pandemic, and we have seen our curve flatten because you've done your part. It's been a tough time. There's no question, if you are a small business owner, if you're mourning the loss of a business, or if you're one of the people that is mourning the loss of a loved one, we have done our part to flatten this curve, and we have saved lives in the process. Now is a moment where we can start to think about turning the dial and starting to re-engage our economy. But we have to be really smart. We have to make decisions based on data and science centered around the public health. That's our next step. We have to stay safe. We have to stay smart. And as we navigate this together, we know that tough times don't last, but tough people do, and we're going to get through this together.
We want to thank you, Governor Whitmer. Before we get things started tonight, here is a quick breakdown of how this evening will work. We have divided our viewer-submitted questions up by category. Those include reopening the state and unemployment. Mike, Frank, and I will all ask questions in one category, along with any follow-ups before moving on. And Mike won a very heated game of rock, paper, scissors, so he has the floor. He will get us started tonight. Mike?
All right, Angie, thank you. Governor, right now you are working through implementing your My Safe Start plan, which you announced on Monday, a systematic and rather methodical reopening of the state. We've received many questions about that plan. Let me start with the 8 regions. How did you come up with the regions? And specifically for people living in Genesee County and Lapeer County who are asking, why are they included with Metro Detroit, which everyone fears will be the last to totally re-engage because it's the state's epicenter right now?
Well, I appreciate the question. I think that that's something that's on a lot of people's minds, so thank you for asking it. You know, as we've looked to Michigan's economy, we can divide areas up based on whose economies are close to one another and how people travel to get to work. We also know that our public health system is divided up into regions as well. And so trying to overlay these two things, because as we think about re-engaging our economy, it is dependent in how well our public health system is ready to respond if there is an uptick in COVID-19. And so these labor sheds, how people travel, how these economies are linked, and what the public health ability is really important to the decision about starting to re-engage and the assessment of risk. Now, the good news is that the vast majority of people in our state have done their part, and we have seen this curve flatten. And there's no question that lives were saved in this process. But now we have to really mindfully, in a data-driven way, with the best health information and statistics, start to turn on and start to re-engage. And as we do that assessment of how it's safe to do so, region is one of the many factors that we look at. As you might recall, last week we were able to move forward with opening up motorized boating and golf and landscaping. Tomorrow I'll be signing an executive order that commences construction industry, both residential and commercial. We know that this is lower risk, and statewide we can start to turn that dial on that particular front. As we look to additional industries, we will be assessing region, but at this juncture, it's been safe to take these steps as a statewide measure. And that's why, you know, as we think about what our next steps are, we're always going to be doing that assessment. The good news is, in Southeast Michigan, we have really seen people do their part and watch those numbers plummet. It doesn't mean we're out of the woods, because we are not. We still had another 600 people die in the last few days, and another 1,000 people get detected with COVID-19 just in the last 24 hours. But we do know that the trajectory we're on has flattened, and that is good news. So we have to stay smart, and we have to keep doing our part. And as we make those next steps, we're going to do so in a way that avoids a second wave.
Governor, you mentioned the numbers, particularly the ones that were released today. The White House guidelines are calling for downward trending case numbers for at least 14 days as states ramp up. And we've yet to get beyond, I think it's 5 days consecutively with that. So are you committed to doing this under the White House guidelines, or are you going to make decisions on what reopens and when independently in consultation with your own team?
Well, I think that the White House guideline is really looking at kind of a national statistics. What we have to work from is what we are seeing here on the ground. And it isn't always necessarily a day-to-day assessment. It is a rolling average that we really should be looking at, that our epidemiologists and Dr. J, our chief medical executive, has counseled and advises. So as we are making decisions, we're making decisions that are right to keep Michiganders safe, are right to reengage Michigan's economy, and right to ensure that we do all of this with the correct data from home. And so while the national standards are helpful, we've got to make determinations based on what is best for us here in Michigan. Michigan has the 10th largest population in the country, and yet we have the 3rd highest number of deaths in the country. COVID-19 has hit Michigan uniquely hard, and that's why we've had to take unique steps to prevent the spread of COVID-19 and to save lives. And so in this moment, I think it's really crucial that we're listening to our best public health minds, and we're fortunate to have a lot of them in Michigan. We're working with the University of Michigan as we look to modeling. We've called in expertise from all of our research universities as we are determining how we score risk for different sectors of our economy so that we keep people safe in the workplace and we avoid a second wave. The worst thing we could do is to abandon all social distancing, to pretend like we are done with COVID-19 and resume life as it was. That would lead us vulnerable to a second wave. As you look to what's happened in other countries around the world, communities and countries that have done that have experienced a second wave as bad or maybe even worse than the first one. We don't want that to happen. None of us wants that to happen, and that's why we have to be really smart about how we incrementally re-engage our economy. And I'm listening to the science and the data. I'm working with some of our great business leaders, both small business and larger business enterprises, and working with labor so that we get this right, to protect our workers, to make sure that we re-engage our economy, and we protect people as we're doing it. Our public health is what centers every decision that I'm making.
All right, we're going to send it over to Frank.
All right, thank you, Mike. Governor Whitmer, people are so eager to bring some sense of normalcy to their lives while they're dealing with all this uncertainty. Now that we've taken a look at the different regions in the reopening plan, we'd like to get to a question we've been asked many times. When will restaurants for dining reopen, and what about hair salons and even pet groomers? What are your experts saying about the type of changes we could expect when these businesses reopen?
Yeah, so I appreciate the question. We all are eager to get back to some semblance of normalcy. This has been hard. This has been hard for the small business owner that spent a lifetime building a business and is worried about whether or not their business will survive. It's hard for the person who lost their job because we've closed bars or because we've closed businesses. It's hard for the parents who have kids at home who are worried about their learning loss between now and hopefully when we can resume in-person instruction in the fall. And yet we know that these actions were incredibly important to take to save lives. We've lost more people to COVID-19 than we lost in Vietnam, and we're not out of the woods yet. And so as we think about re-engaging sectors of our economy, we're asking questions, we're doing the analysis, looking at the data and crunching it to see what really is the inherent risk with different sectors of our economy. Questions like, is this something that engages with the public? Now, in restaurants or in hair salons, yes, it is. Is this work that is done inside or outside? If it's inside, it's inherently a little higher risk. Are they able to practice social distancing? Can you spread 6 feet apart and wear masks? What does that mean? What are the protocols necessary to keep people safe? And when you do this analysis, you can conclude that certain activities are higher risk than others. That's why the construction industry is lower risk activity, and that's why that's the next to come online. As we are looking to bring other parts of our economy online, we have to ask these questions, do the analysis, and then also pursue with leaders in the industry protocols that'll keep people safe. We're watching what is happening in other parts of the world and in other parts of the country. When you look at what's going on in Georgia, it's been determined that it's safe to go back for business for these types of businesses that you described, and yet the public does not think it's safe to do so. So simply declaring something to be open and having the public sentiment have the confidence that they're going to be safe are two separate things. And that's why we really want to get this right, so that the public knows they're going to be safe, so that the workers know that they will be safe, and so that when we re-engage, we can do so in a way that we don't have to pull back because people are observing these important protocols. So things that interact that personally with the general public will come on a little bit later, but we're working with the restaurants and we're working with various industries to make sure that we've got the protocols in place so people are safe when we do re-engage. Trust me, I'm as anxious as anyone to keep turning this dial forward, but it's got to be driven by what we're seeing in terms of COVID-19 spread, because there still are a lot of places in Michigan that we have to keep a very close eye on where numbers are continuing to climb at concerning rates.
Governor, the UAW says it doesn't want workers back in the plants too early unless it's safe. UAW President Rory Gamble saying recently, we haven't done enough testing to understand the threat its members face. How many changes will auto plants and other factories need so there can be social distancing and other safety protocols?
So I've been having very regular conversations with Rory Gamble, the president of the UAW, as well as the heads of the big 3 auto industry, auto companies. And what I know is this: they've been working very closely together to make sure that they've got protocols to keep people safe when they return to work, whether it is erecting plexiglass dividers between people who are on a line who can't practice that 6-foot distancing, whether it is protocols of making sure that you don't have big shift changes where people are coming and going in a small space, whether it is ramping up slowly, perhaps a third of the workforce, in the beginning and ramping up slowly, bringing certain parts of the organization online. I believe that they've got a lot of great protocols that they've developed with the UAW. But the point is, our workers have to know that they're going to be safe in the workplace. They got to know that when they go to work, they're not going to bring COVID-19 home to their families. The thing about this virus is that there's no cure and there's no vaccine yet. This is something that's highly communicable. And for one person in your household, can feel like a fever. For another, it can be fatal. And so we really have to be diligent in making sure that we're protecting our workers and our families. And that's why I'm working very closely with both the UAW and the Big 3 to make sure that when we turn the dial and bring that part of our economic sector on, that people can have confidence they're going to be safe. It is a very real concern that Rory has voiced. I've talked to a lot of people who work in various parts of our economy, and they want to know they're going to be safe when they go back to work, and that's our job to make sure that they are.
All right, thank you, Governor. Angie?
Thank you, Frank. Governor Whitmer, we want to continue talking about the reopening plan, specifically the timeline for each region. We have viewers watching this evening across several regions, viewers who are scared about their health and their finances. They want to know if there will be multiple weeks or even months between each region reopening to be able to track any of the potential spikes.
Well, the quick answer is that I hope not. What we have seen from the Michigan public is that, by and large, people have done the right thing. That's precisely why we saw what was predicted to be this huge spike actually flatten out. I can issue all the orders in the world, but it's actually the people of our state who are doing the right thing and making the difference. And so I'm really grateful. Our nurses and doctors are grateful. Our police and fire are grateful. is leaders like Sheldon Neely, who are doing everything they can at the local level to make sure people understand what's really at risk here and that we are doing our part. And I am so inspired by that. What we know is that at this point, we feel comfortable turning that dial and re-engaging our construction industry. There will be additional industries to come online in the coming days, but every day we're watching these numbers. What percentage of tests are coming back positive? What do we see in a particular region? Is there a spike in a particular region that we need to understand and make sure that we've got the appropriate tracing protocols and that we are able to isolate people who have COVID-19? All of these are pieces that have to work together. And so for us to take the next step, we all need to keep doing our part. It is always dependent on what those numbers look like. So as long as we are protecting ourselves, wearing a mask when we are out in public in an enclosed space, keeping that 6 feet apart, staying home unless you gotta get out for something that is really like food or medicine. So long as we keep doing that, we're gonna keep turning that dial. And every few days you'll hear me talk about, give you an update and talk about the next sector to come online. My hope is that everyone keeps doing what they're doing and we can make progress every week until we get to a point where we are re-engaged safely, fully.
Michigan's sudden job losses and the declining sales mean that the state can expect big drops in its two main non-federal sources of revenue, income tax and sales tax, just as people are turning to our state for more help than ever with unemployment, food assistance, health care coverage. So how will we begin to make up for this loss in our revenue for our budget, and will it mean an increase in our taxes?
Well, like states all across the nation, we have taken a real economic hit in our households, in our businesses, and in our state budget as well. There is no question that we are going to have to make a lot of tough decisions. Now, the federal government has passed a couple of supplementals. My hope is that there's another one coming for state budgets and for local budgets for our municipalities, our cities, and I think that it's really important that we have the flexibility we need to meet the needs of the people of our states, because we are different. We are not all the same, and we're going to have some really important things that we've got to do as we re-engage. For instance, we need to make sure that we are able to wrap our kids with the support they need so that the learning loss that we see over a typical summer isn't worse because we've had to be out of in-person instruction longer than the usual summer. We are going to have costs associated with COVID-19 that we could never have predicted and that are going to be harder to make sure that they are invested in, because we'll probably have about a $3 billion hit to our general fund in this year. And so that's why governors across the country, including Republican and Democratic governors, are banding together to try to get Congress to move this forward. And while we're talking, I should recognize our congressional delegation. They've been really great to work with, Republican and Democratic. We've all said we're Michiganders first, and we've been able to do some important work together, and I'm hopeful that as they reconvene and start to talk about an additional supplemental, that they help us out, because the state and the city, unlike the federal government, can't run deficits. We have to have balanced budgets, and so assistance out of Washington, D.C., our taxpayers need to come back into Michigan to help us get through this global pandemic.
Thank you, Governor. Mike?
Angie, thank you. Governor, we're moving to unemployment now. We have seen more than 1 million people in this state lose work during the pandemic. Most have been able to get through and file for their unemployment benefits, but I say most because it's not all. We have a ton of questions here tonight from viewers who want to know what you and your team are doing to fix the website.
So I am here actually with the Director of Labor and Economic Opportunity, and he is sitting right to my left, and I would love for him to tell you a little bit about what's going on. Before I hand it over to him, though, I'm just going to acknowledge one thing. A lot of Michiganders are hurting, and this has been a tough time. It's been a tough time for seniors who are isolated and haven't seen their grandkids. It's been a tough time for business owners who are worried and who are trying to bolster all of their employees but aren't sure what the future is going to look like. It's been a tough time for a lot of families who I've talked to who are struggling because they've lost a loved one, or the nurses and doctors and people on the front line who are stressed out and worried about their own health as they take care of everyone else. What we have tried to do in state government is to make it easier for people to apply for unemployment. We've cut a lot of the red tape that was put there in the last few years that have made it harder for people to get this help when they need it. We also have extended unemployment so that there's additional support for people right now, and I think that that's important. We've had over 1 million people file for unemployment. We've helped over 800,000. We have done an incredible amount of work, and yet that still means that there's tens of thousands of people who yet need the help. We are redoubling. We've quintupled the number of people that are working at the unemployment on the front lines. We will not rest until everyone gets the support to which they are entitled. And you've asked about an update on the website and about other aspects of unemployment. I'd love for the director to add a little bit more to that.
Governor, before you turn it over to Mr. Donofrio, just let me get you on about the red tape, because there are still a lot of people who are telling us that they're having great difficulty getting through some of that red tape. What can you tell those people about what they should do to cut through it?
So one of the things that I did early on during this crisis was to eliminate the requirements that people needed to get paperwork from their former boss, for instance, as one example. This was something that was an impediment that was created over the last number of years, and we wanted to make sure that people in the midst of all of this stress didn't have to do that in addition. I know that there are tens of thousands of people that are frustrated, they've been trying to get through. They need the one-on-one help, and that's why we quintupled, times 5, the number of people that are working the phones. And we're not going to stop until every claim is met. But additionally, I think that there's more to the story that I know the director is in a better position to share, and I'd love for him to have that opportunity.
Yeah, thanks, Governor. And, I think the thing we have seen in terms of unemployment in this state is that the health crisis caused by COVID-19 has caused a deep need for unemployment benefits. The Department of Labor today released numbers, and millions more of Americans were added to the unemployment rolls. In Michigan, we have 1.3 million who have sought unemployment claims. Now, that's historic numbers that we've never seen in this state, and certainly we've never seen in such a short period of time. We know that other states have struggled to take in these numbers, these claims, to pay out claims as well. And so Michigan's not alone in the fact that we've had some trouble with folks getting through. The website has been slow at times, but it is fully functional and operating, and people are able to get through. We have over 1 million people who are accessing it, or 1 million account accesses each day on the website. So the good news is that we've been able to get benefits to about 1.1 million people. That represents about $3 billion in benefits that we've already paid out in a very short period of time. But that small comfort, we know, to the thousands of people who still need that one-on-one help because they've gotten caught in some legal issue that they have to resolve. And we're committed to making sure that we get through every single one of those. No one will lose $1 of benefit because of the fact that they are still needing our one-on-one help. We've added those hundreds of people to the call centers, hundreds of people to the adjudication process, and to make sure that every single person is going to get the benefits that they need. And we're committed to doing that. We're not going to rest until that happens.
All right, let me send it back over to Frank now.
All right, thank you very much, Mike. Governor, we have heard from many doctors and nurses since the crisis began, so many, desperately pleading for more personal protective equipment. Massive shortages across the country, including right here in our state. Many Michiganders, business leaders, various companies, all answering the call for help. But moving forward, what can our state do to build up its supply of PPE for frontline workers?
Yeah, thank you for that question. One of the most startling conversations early on in this process was a conversation with the nation's governors and the White House. And it was conveyed to us that we were going to have to come up with all of these pieces of equipment on our own. That the national stockpile was never going to be able to meet our needs, and they told us early on, you better go start looking for this. And I think that that was a very sobering moment. We realized that in the State Emergency Operations Center, we would have to stand up a procurement office that would have a global reach. We have followed up on every lead that has been sent to us. We have contracted around the globe. And I know that some eyebrows went up when I acknowledged that we're also kind of bidding against one another, we governors. And oftentimes our contracts would be superseded by the federal government right as we were expecting to take, we were expected to receive them. And so one of the things that we have been successful at doing after we got all of our, as much as we could out of the federal government, in addition to that, we've been contracting. And so we've been able to build up a storage of PPE. We're talking about days, maybe weeks of it. Early in this crisis, we were living literally day to day, where doctors were wearing masks and nurses were wearing masks for a full 12-hour shift. That's dangerous. That's not how it should be. And it doesn't mean that because we've gotten a few days worth or a few weeks worth in some hospitals' cases, that we can let up for even a second. We have to continue this effort. We're grateful for so many Michigan businesses, too, that have started to manufacture this PPE. It's really important. As we start to re-engage our workforce, we know that these pieces of equipment are going to have to become, commonplace. We know that you're going to need to wear a mask for, the foreseeable future when you go to the grocery store, for your safety and for the grocery clerk's safety. And that's why we are working with the MEDC and the Pure Michigan Business Connect to ensure that as businesses come online, they've got the ability to get that kind of PPE, that where we are manufacturing it in Michigan, we are connecting businesses so that they can keep their workers safe. These are the protocols that are going to be a part of our new normal. And so we've got to make sure that everyone has access to what they need to keep themselves, their businesses, and their customers safe. And that's what this Pure Michigan Business Connect will be working with us and the Small Business Association of Michigan to make sure that that is available to all businesses as we re-engage.
Well, Governor, now that you have opened the face mask can of worms, let's go there. Last Friday, your executive order requiring face masks be worn in public enclosed spaces, and there's been a lot of confusion. We're seeing a lot of people who don't wear the masks. So here's what we want to know. Should that be made mandatory? Are you going to enforce it? If it was so important, why has this waited until now? And why don't you and your team wear masks during your weekly briefings at the podium?
Okay, you put a lot of questions in there. I'll do my best to remember them all and get to each of them. First and foremost, I am sitting near Dr. Janae Caldoun, 6 feet apart, but she is able to expound if you would like to follow up with her. I'll start with this. We've learned a lot every single day of this crisis. COVID-19 is a novel virus. That means it never existed before. We're learning every single day. There's no cure, there's no vaccine. It's highly contagious. We're learning more and more about it every single day, and it can be very deadly. It can stay in the air, they're starting to conclude, that when we are talking to one another, we're exposing one another. And so wearing a face covering is really important. We don't want the general public to wear N95 masks. We need to save surgical masks and these respirators for our frontline workers, nurses and doctors and respiratory therapists and police and fire. But we want everyone to wear a face covering when they're in enclosed public space. It's really important. I was talking with a number of our grocery store workers the other day, and some said in their stores, everyone's wearing a face mask when they come in. Others said, very few people are. They're scared. They got to show up so that we have food. They are critical to our food supply, critical to feeding the people of our state. We need people to observe this face mask order because it is about not just your health, but everyone else's as well. And so that's really important. Now the question, why don't we wear them during our press briefings? Well, I'm not in a public space right now. This is a very controlled space in the office building. There are very few people in this room right now. We are observing the social distancing, and I think it's important that we are able to communicate. You can't see on this stage, but we have it marked out how far we need to be from one another to observe those practices. So the fact that it's not a public space makes this a little bit different. But when I am out and about, I am wearing my mask too.
And so employers in private spaces that are not open to the public can make that same decision?
The protocols are going to be different depending on the workplace. In workplaces where you can't observe the social distancing and there is high density, then face masks will have to be a part of the protocol. And so it's not simply that there is one rule that makes sense everywhere that you go, but in the workplace, especially if you are engaging with the general public, face masks are going to have to be a part of the protocol.
Dr. Caldoun, did you want to add to that?
Absolutely. So there's only so many tools that we have in our toolbox when it comes to COVID-19. As the governor mentioned, there's no vaccine, there's no antiviral treatment. So anything we can do, and particularly the social distancing, we have to make sure we're doing that as aggressively as possible. So face masks, again, people can make this at home. It's very simple. You can use a handkerchief, you can use a cloth, you can use a bandana. Just put it over your face when you're out and keep others safe.
All right, thank you very much. Angie?
Thank you, Frank. Governor Whitmer, we want to focus now on some of the regulations you've made as governor during the crisis. There are some who say you are abusing your power. Just today, there was a second protest in Lansing where people say you are overreaching. And 2 weeks ago, thousands came to the Capitol to protest. The emergency declaration ends tonight, and the Republican-led House voted to authorize a lawsuit challenging your authority and actions to combat the pandemic. First, what is your response to the legislature's action today? And second, what do you say to those people, including members of the legislature, who say the restrictions you've put in place are not within your power as governor?
Well, first I'll say this. We remain in a state of emergency. That is a fact. For anyone to declare mission accomplished means that they're turning a blind eye to the fact that over 600 people have died in the last 72 hours. Another 1,000 people were diagnosed as COVID-19 positive. That we've got sectors of our state that the numbers are continuing to climb that we are watching very closely. So everyone's entitled to their opinion. But I am not going to make decisions about our public health based on political games. I'm going to make them based on the best science, the best data, what our epidemiologists and public health experts are telling us. You can ask any nurse or doctor or grocery store worker in this state, are we out of the woods yet? And they would say no. It defies common sense and it defies science to make any declaration otherwise. And so we are still in a state of emergency. We have to take this seriously. But we also know that if we're smart, that if we all continue to do our part, that we can start to turn that dial and re-engage safely. But we have to stay smart. Politics has no business when we're talking about saving lives. Every person in this state matters to me. Whether you agree with this order or not, we have to be vigilant. We have to make decisions based on the best science. And I'm going to do everything I can to save lives in the state of Michigan and safely and responsibly re-engage our economy so that we can all be stronger as we come out of this eventually. But right now is not the time for politics. Right now is the time to do the next right thing, and that is continuing the stay-home order. It is continuing the state of emergency, and it is continuing to do our part. We will get through this, but we're not going to play politics when people's lives are on the line.
Can you respond directly to the lawsuit?
No lawsuit's been filed. I can't respond to something that hasn't been filed. I know that there's a lot of political conversation at the Capitol. I am staying focused on making sure that we make decisions that protect our public health and that put us in the position where we can start to re-engage sectors of our economy, and I'm not getting distracted by the political maneuverings that are going on at the Capitol.
Okay, thank you. There have been so many questions sent to us about whether or not you are following your own orders. As we just talked about, Rick says that you're not wearing a mask in an enclosed public location, which you already responded to. Anthony says that you've traveled. Alicia wants to know if you've gotten your hair professionally done. I know several of us on air have been asked that very same question too, and I'm going to put it right out there. My husband colored my hair for the very first time last weekend. What do you say to people who claim you're not practicing what you preach?
You know what, I think it's really important that leaders model the behavior they ask of others, and so I have done that scrupulously. I've heard all the rumors too that I've been sneaking out to get my hair done. Not true. You can ask my 18-year-old who colored my roots in the middle of our kitchen at the residence. I also saw the rumor on your screen that I was up on Mackinac Island. I haven't been up to Mackinac Island since last October. I have been at the governor's residence, which is where I do phone call after phone call, interview after interview. I check in with our first responders. I do Zoom meetings, but I have been in Lansing, Michigan in the middle of this crisis, making sure that we are doing all the things to keep people safe. And all of those rumors, just discard them because they're not true.
Thank you, Governor. Mike?
Angie, thank you. I love the fact that you let your husband color your hair. I'm fortunate enough to be able to cut my own, so I guess I'm okay in that category as well. Governor, one thing people cannot do for themselves is surgery, and we get this question from Jody R. tonight regarding elective surgery. She was scheduled for a hip operation in late March until the shutdown was ordered. She wants to know when to expect elective surgery to be allowed again.
So her surgery is permitted right now, and the fact of the matter is we had to stop all unnecessary, I don't mean to say that it's unnecessary, all non-urgent surgery so that we could conserve those PPE, those masks and the gowns and the gloves. We were running so short on them when our numbers were increasing so dramatically that we really had to conserve for that purpose. Now that we've been able to procure a lot of that, now that we have some, in our possession, we're able to move forward with some of those surgeries. And so I do know that there are hospital systems that are starting to schedule those. And I hope that if Jody is ready to have that surgery, that she gets on the schedule, because she certainly can move forward safely now.
So is it pretty much now up to the individual health systems and hospitals to determine whether to re-engage on that level? And does the same hold true for dental procedures?
So, well, being married to a dentist, I can tell you this, that my husband has been going in, as have dentists across the state, for emergencies. They have been doing that. As you can imagine, though, dentistry poses a unique risk because you're literally, working on someone's mouth, which is where COVID-19 resides. And so that will be coming online a little bit later. I'm not making any proclamations here and now, but we are working diligently to make sure that we've got the appropriate protocols to keep people safe. With regard to the first part of your question, I think that Dr. Caldoun would actually be a better person to answer it, as she's been working directly with our hospital systems across the state on that.
Yes. Thank you, Governor. So I'm a practicing emergency medicine physician, and one thing I know is the most important relationship is that between a doctor and the patient. So even with our executive order, we still allowed a physician to determine what was time sensitive and urgent for that patient. So things such as diagnostics and treatment for cancer, diagnostics and treatment for advanced heart disease. We didn't want people to delay things that were necessary for someone's health care. And so we've been working very closely with the chief medical officers and the healthcare system leaders, and they are, in a very smart way, bringing back online various procedures and doing it in such a way such that they have enough PPE, they have enough hospital beds, and they're making sure patients are safe, particularly when it comes to testing patients for COVID-19 and making sure we don't see a surge in cases. I also want to say it's really important that if people have things like chest pain, difficulty breathing, our hospitals are open. Our emergency departments are open. Please don't delay seeking emergency care if you think you're having a medical emergency. Talk to your doctor, and if you're having an emergency, go to an emergency department.
And Dr. Caldoun, while you're there, do you feel like if we end up with a second round of cases here, medically speaking, are we ready as a state to handle that? And then the governor can address that as well when she returns.
So we're watching that very closely every day. You all know, particularly in Southeast Michigan, there were a couple weeks there where we were very concerned, where we had a surge in cases and we were running out of PPE, and we saw a lot of our ICUs filled with patients with COVID-19. One of the things we're looking at very closely is hospital capacity, but we have to look at it by region. We know there's some regions of the state that are still seeing an increase in the rate of rise of cases, and they also don't have the number of hospital beds that some of our southeastern Michigan hospitals have. So as we're looking at how we slowly dial up and reopen the economy, we're going to be looking at that hospital surge capacity as well on a regional basis.
And very quickly, Governor, anything you want to add to that? Would the restrictions be the same if we end up with a second wave?
Well, that's what we're hoping to avoid. So I think that while we might not all in this state of almost 10 million people see eye to eye on everything that has happened, I think we all agree we don't want to be in another stay home, stay safe order come August or September or October. What we want to do is make sure that as we turn that dial, we continue to build up our public health capacity and we keep the spread of COVID-19 down, and that we are able to re-engage sectors of our economy. We want to avoid a second wave at all costs. It would be more deadly, it would be more harmful in our economy, and that's why everything that we're doing is going to be driven by the best science and data with the partnership of the business community so that we've got the protocols to keep people safe and to avoid that second wave. None of us wants to be in that position where we've got to go back into a stay-home order. And I can tell you, me the most. We don't want to have to do this again. I never imagined when I took my oath of office that I would have to use the powers that I have to try to save lives. I never imagined that we would have almost 3,800 people who've lost their lives to a virus that is ravaging the globe. And yet here we are. And so what we have to do is to be really smart about how we re-engage so that we avoid that second wave. We can do this, but it takes all of us to be a part of this. We've done a phenomenal job flattening the curve. And it's because everyone did their part, or the vast majority of people did. We've all got to continue to have that mindset as we re-engage, because each step depends on those numbers staying low.
All right, Frank, over to you.
Thanks again, Mike. So many changes, Governor, since we've all gone through since early March when the first cases of COVID-19 surfaced in Michigan. Folks can't go to church in person. Big family get-togethers are off limits now. Even weddings are canceled. One mother of the bride wrote in concerned about her daughter's wedding in mid-July up north with 150 people invited. So when and how do you plan on easing the restrictions on these types of gatherings, weddings, but also simpler gatherings with friends and family?
So I'm sorry to say I can't give you a specific date. It is probably not going to be safe to congregate in masses for quite a while. And it's heartbreaking, I know, especially if you're planning a wedding, or like me, I was planning a graduation party. My daughter is having her milestone of graduating from high school this year, and yet we can't do any of those things right now safely. She's heartbroken about it, as am I, but we know that Michigan's not alone in this moment, that this is what is happening all across the country, that these big gatherings just can't safely happen right now. My hope is that we can start to re-engage safely and that we'll get there. But I can't tell you that it'll happen by July. I can't tell you when precisely it will happen. It depends on how well all of us do our part as we take these steps to re-engage. My hope is that we can have big gatherings again. But I think that when you consider the hardship that you just described, one of the things that I think about is the people that are mourning the loss of their loved ones. You know, I spoke with a couple of parents who lost their daughter, and when they memorialized her life, they couldn't congregate and support one another in person the way that we usually do when we lose a loved one. They couldn't have a church service where people came together and physically supported one another and hugged one another. We have to do things differently right now to save lives, and it is hard. And it is something that we will get through. But at this point in time, we've got to continue to be smart and vigilant and safe.
So, Governor, right now, people don't know if they should book plans for the summer. Business people don't know whether to expect them. Usually, right around this time of year, Saginaw is raising funds for their fireworks show in July. Are these big summer events even going to happen? What can you tell business people and their consumers about whether or not they're going to have a chance to enjoy the summer in Michigan?
Well, you know, we will all enjoy the summer in Michigan. It's going to be a beautiful summer. The question is, will we be able to congregate and enjoy it in the way that we're used to? At this point, we cannot say definitively if we'll be able to do that or not. We do know that, you know, COVID-19 is still present in Michigan. Another 1,000 people were detected to have it in the last 24 hours. We've lost almost 3,800 Michiganders to this disease. It's really important that we continue to be vigilant and safe and smart and making decisions based on the best science. It's hard, though. I know that people have made great sacrifice, and I know what this means to our economy. I know what this means to our traditions of summer festivals and 4th of July celebrations, and yet if we take this seriously and do the right thing now, we will be able to do that at some point in the future. But we're going to let the science and the data direct when it's safe to start to re-engage in ways like that. And we can't let feeling or emotion trump what we know to be the best practice and what the right thing to do is. We've got to do the next right thing, and the next right thing right now is to stay in this state of emergency. The next right thing right now is to slowly engage and monitor and measure and make sure that it's safe to take the next step, and we will do that. We will get there. It might not be as fast as we all want, but we are going to get there. And I just am grateful and inspired by the people who continue to do your part and take this seriously. You're the reason we flatten the curve.
All right, Governor Angie, we'll send it back.
All right, thank you, Frank. We have a couple of quick questions we want to get through, Governor. First, we've received a lot of questions about camping. Specifically today, the DNR announced state-managed campgrounds will remain closed until at least June 22nd now due to the coronavirus pandemic. Chantel asked why camping is different from traveling to a second home since their trailer is their second home.
Yeah, I appreciate the sentiment of the question. I know that, you know, in this moment, a lot of things seem to not make sense. I guess what I would say about the DNR's decision is that when people camp, they often use the same facilities. And that's, I think, what the concern is. When people are together in close quarters, they're not able to practice the social distancing as well. And that's the concern about how COVID-19 spreads. It is highly contagious, and we are doing everything we can to mitigate the places and the number of opportunities that people have to congregate. I, grew up having gone to campgrounds. I know that this is a family tradition and that it's something that is about the outdoors, and it is about quality time together, and it's about enjoying this beautiful state of ours. And yet we think that in this moment of this global pandemic, this is the right policy for now. Our hope is that by the end of June, we can start to engage in that wonderful pastime. But we're going to have to make decisions based on what we're seeing in terms of the numbers of COVID-19, how many people have been diagnosed, how many hospitalizations we have at that point in time, in order to feel confident that we can make a decision that is going to protect people's health.
We have another big topic on the minds of many, especially at my house with two boys, sports. For this question, we're going to hand it off to a very special reporter. Take a listen.
Hi, Governor Whitmer. My name is Nasir, and I would like to know when I can play sports with my friends again.
In case you didn't catch that 9-year-old wants to know when he can play. Yes, it's an important question. When can they play sports with their friends again? What is your message to him and all our other sports stars waiting to get back on the ball field?
all of our sports stars and sports fans, and I know that this is a part of our culture that we are not able to engage in right now. And I just suggest that we be patient. And I think he was asking about basketball. I hope that he can continue to shoot hoops at home to practice so that when he can start competing, he's ready. But we recognize that these traditions are really important, and that physical activity is really important, that it's good to be outside as much as you can, but we still need to have that social distancing. And so what that timeline looks like is going to be determined by how well everyone continues to do their part. So we see those numbers go down, and then we can talk about what safely engaging in sports looks like again. There are some sports that don't have as much contact, and when you're playing with the same instruments, if you're playing with the same tools, you're playing with the same sports paraphernalia like a basketball or a football. These are the things that we get concerned about, of how we transfer germs to one another, and I think we're going to have to really be thoughtful about how we let our kids re-engage. The good news is that we see the numbers move in the right way, and we are able to take some smart steps now, and we're hopeful to get all the way there so he can get back out with his buddies.
We have one more that we need to get to out of the thousands of questions we received. This is one of the most common. A lot of questions about not allowing golf carts. Golfers like Jeremy want to know why they can't use a golf cart with only one person per cart.
Well, I appreciate the question, Jeremy. I know that people were really pleased when we moved forward and started permitting golf again. And it is a good outdoor activity, and I'm glad that you are out doing it. With regard to carts and the sharing of, a vehicle, that's a way that COVID-19 spreads. And even if everyone's in their own cart, it requires, the maintenance and the additional touching from the people that have to maintain those carts and the people that are using those carts. And so to permit golf, where people are out and taking charge of, carrying their bag or wheeling their bag behind them, was a step toward trying to normalize in that particular realm. The carts just was one additional thing that would foster additional spread, and we thought that it was the right decision right now.
Okay, we want to thank you, Governor, for giving our stations and our viewers this opportunity to hear directly from you. That about does it for our time this evening. Before we all sign off, we do want to give you a couple of minutes for a few final words.
Well, thank you, and thank you to the anchors. Thank you for tuning in, to all of you at home. Thank you for doing your part. This is a moment none of us could have anticipated. This is a moment that will forever have changed many lives in our state. There are a lot of people who are struggling right now, and if you know people who are and you can lend them some support, please do. We've got to help one another and have one another's back right now. As we are navigating our next steps, we have to remember that avoiding a second wave is really important. And so it's not a switch that we just flip and life returns to like it was before COVID-19. We have to be really smart and think about this as a dial where we take a step, we measure, we make sure people are safe, and then we take the next step. We will continue to move forward. There will be light at the end of the tunnel, and we will get through this. But it depends on all of us continuing to do our part. And so I just simply want to say thank you for what you have done. We will help one another get through this moment. And I hope that you have a good night, that you stay engaged, you stay informed, and you continue to do your part, because you're the ones that are truly making a difference. Your actions have saved lives, and together we will beat COVID-19, and we will get through this. Thank you.
Governor Whitmer, Dr. Caldoun, and Director Donofrio, we thank you all for participating, and we certainly thank all of our viewers for tuning in tonight and for submitting all of your questions.
And we did receive thousands of them. Of course, we weren't able to get them all answered tonight. But we do hope this special event provides important information so you can make informed decisions when it comes to your life, your health, and your family.
For Mike Woolfolk at Mid-Michigan Now, Frank Turner at WNEM TV5, and for all of us here at ABC 12, thank you so much for watching. Thank you for doing your part. We hope that you have a great evening and stay safe.